the graveyard of red blood cells. That's what they call the spleen. And you know, when I first heard that name back in medical school, I thought it was some kind of strange metaphor. But then when I started working with patients who had to have this organ removed, I understood this isn't just a poetic comparison. This is a reality that changes a person's life forever. I had a patient, let's call him Michael, 34 years old, car accident, ruptured spleen, emergency surgery, and there he is, lying in the hospital bed after the operation asking me, "Doc, so what now? I'll survive without this thing, right?" Technically, yes, but there are nuances that most people don't realize. Look, the spleen is this small organ, about the size of your fist, weighing around 150–200 grams. It hides under your left ribs, and most people don't even feel its existence until a certain moment. But this little wrinkled thing, as someone jokingly calls it, does an incredible amount of work every single day. And here's where it gets interesting. Imagine a massive recycling factory, operating 24/7, no days off. Blood constantly circulates through the spleen, and it acts like a strict quality controller, checking every single red blood cell. Old, damaged, can't perform its function anymore. The spleen takes it and breaks it down into parts. Iron gets returned to the body to create new red blood cells. The rest gets disposed of. In a day, the spleen can destroy up to 20 million old red blood cells. Can you imagine that scale? And now I want you to think about something else. The spleen isn't just a graveyard for blood cells. It's also a military garrison for your body. It produces lymphocytes, a special type of white blood cells that fight infections, and here it works like a training camp for immune cells. Bacteria enters the bloodstream. The spleen recognizes the threat, activates the immune response, produces antibodies. This happens so quickly and efficiently that we don't even notice this internal battle. Another thing that's just amazing, the spleen can store blood as a strategic reserve. Approximately 30–40 milliliters of blood are constantly kept there in standby mode. Blood loss? Shock? The spleen instantly releases this blood into the general circulation, maintaining pressure and oxygen supply to vital organs. It's like an emergency backup for a rainy day. And then a person loses this organ, surgery, rehabilitation, discharge. You can live a normal life, doctors say. And it's true, but it's truth with a big but. When the spleen is gone, other organs try to take over its functions. The liver starts destroying old red blood cells more actively. Lymph nodes compensate for part of the immune work. Bone marrow increases production of new blood cells. The body adapts, that's a fact. But completely replacing the spleen is impossible, and here's why. After spleen removal, a person becomes significantly more vulnerable to infections. Particularly dangerous are bacteria that have a capsule, pneumococci, meningococci, Haemophilus influenzae. These microorganisms cause pneumonia, meningitis, sepsis, and for a person without a spleen, these diseases can develop lightning fast and progress much more severely than in those who have this organ in place. There's this thing called post-splenectomy sepsis. This is when a common infection that would cause a mild cold in a normal person escalates into a life-threatening condition in a person without a spleen, literally within hours. Temperature shoots up to 104 degrees Fahrenheit, blood pressure drops, organs start failing one after another. Mortality with such sepsis reaches 50 to 70%. Imagine every other person doesn't survive. Going back to my patient Michael, 6 months after surgery, he ended up back with me. Regular cold, he thought. 2 days of fever, a bit of cough. No big deal, he thought. It'll pass on its own. But there's no spleen, so the body can't mount a quick immune response. By the time he finally came to the hospital, he already had sepsis, pneumonia in both lungs, and we fought for his life for 3 weeks in the ICU. And you know what's most striking? Many people after spleen removal don't understand the scale of changes. They're told, get vaccinated against pneumococcus, meningococcus, get your flu shot every year. But someone thinks, why bother? I feel fine. They're advised to carry antibiotics with them for emergency use at the first symptoms of infection, but someone forgets or ignores it, and that's when trouble comes. There's another aspect that's rarely discussed. After spleen removal, blood composition changes. So-called Howell-Jolly bodies appear. These are remnants of the nucleus inside red blood cells. Normally, the spleen removes them, but when it's not there, they remain. This isn't dangerous in itself, but it's a marker showing that compensation is incomplete. Acanthocytes can also appear, red blood cells with irregular shape. They carry oxygen worse, break down faster. Platelets, cells responsible for blood clotting, also behave differently. After splenectomy, their count can rise, sometimes even too much. This increases the risk of thrombosis, formation of blood clots in vessels, a clot in the pulmonary artery, stroke, heart attack. All of this becomes more likely. I think you're probably thinking right now, okay, the spleen is important, but if it needs to be removed, there's no choice, right? And that's true. Sometimes there's no other way out. Trauma with rupture, certain blood diseases where the spleen destroys too many blood cells and threatens life. In such cases, surgery is life-saving, but there are situations when the spleen is removed prematurely or without sufficient grounds. And here it's important to understand the scale of loss. For example, like in some hematological diseases, doctors may suggest spleen removal as one of the treatment options. But modern medicine is developing, new drugs appear that allow preserving the organ and controlling the disease. So it's always worth finding out, are there alternatives? Can we try other treatment first? With spleen injuries, doctors are now increasingly trying to preserve the organ even if it's damaged. Embolization of vessels, partial removal, suturing the rupture, many techniques exist. Even if only part of the spleen remains, it's better than its complete absence. Because even 25 to 30% of functioning spleen tissue provides significant protection against infections. It's especially important to preserve the spleen in children. Their immune system is still forming, and without a spleen, they become extremely vulnerable. The risk of severe infections in children without a spleen is tens of times higher than in adults. Therefore, in pediatric surgery, the rule is, do everything possible to preserve at least part of the organ. Let's return to the question of adaptation. Yes, the body adjusts. A year or two after surgery, compensatory mechanisms work more or less smoothly. A person can work, play sports, lead an active life. But this doesn't mean everything is like before. Imagine you lived in a house with 3 locks on the doors, an alarm system, and video cameras, and then you were left with just 1 lock. Technically, the door is still locked, but the security level is completely different. And if before you could sleep peacefully, now you need to be more vigilant. That's exactly how it is with immunity after spleen removal. The liver and lymph nodes, they're that 1 lock. They work, but they're not enough for full protection. So a person needs to be more careful. Avoid contact with sick people during epidemics. See a doctor immediately at the first symptoms of respiratory infections. Definitely get vaccinated. It's like additional protection that compensates for the weakness of immunity. And here's what else is important to understand: the impact on psychological state. When a person realizes that their body is now more vulnerable, it causes anxiety. What if I get sick? What if it's that dangerous sepsis? Every rise in temperature, every sore throat becomes a source of stress, and this is normal. This is a natural reaction to a real threat. But there's another side. Some people, on the contrary, forget about doctors' warnings and live as if nothing has changed. They don't get vaccinated, don't carry antibiotics, don't pay attention to symptoms. And this is even more dangerous because when trouble comes, it comes suddenly. Like, the ideal balance is conscious caution without paranoia. Understand the risks, but don't let them control your life. Follow doctors' recommendations, but don't turn your life into constant waiting for illness. There's an interesting study conducted in Scandinavia where they observed people after splenectomy for 20 years. It turned out that those who carefully followed recommendations, got vaccinated, quickly responded to infections, had a mortality rate from infectious complications only 2 to 3% higher than the general population, and those who ignored warnings up to 15–20% higher. The difference is colossal. The study also showed that the most dangerous period is the first 2 years after surgery. That's when the body hasn't fully adapted yet, and people often lose vigilance, thinking that if they survive the operation, everything is already fine. But statistics say otherwise. Most cases of post-splenectomy sepsis occur precisely during this period. Now let's talk about specific actions that need to be done after spleen removal. This isn't just theory, these are practical steps that save lives. First, vaccinations. This isn't a recommendation, it's a necessity. Pneumococcal vaccine, mandatory every 5 years. Meningococcal, once every 5 years. Flu, annually every fall. Haemophilus influenzae, one time. These 4 vaccines are your shield against the most dangerous infections. Second, rapid response antibiotics. Your doctor should write you a prescription for broad-spectrum antibiotics that you always carry with you. Temperature started above 100.4 degrees. Chills, feeling unwell. Take the antibiotic immediately. Don't wait for a doctor's visit. This can buy you critically important hours. Third, mandatory consultation with a doctor for any suspicious symptoms. No need to wait for it to pass on its own. Fever, pain, unusual cough, straight to the doctor or even call an ambulance if symptoms are escalating quickly. Fourth, wearing a medical bracelet or card in your wallet with information about the absence of a spleen. In case of an accident when you can't tell doctors about your condition yourself, this information can save your life. Emergency doctors will immediately understand they're dealing with a high-risk patient and start aggressive infection treatment right away. Now about how this affects everyday life. Can you travel? Yes, but with caution. To tropical countries, only after consultation with a doctor and prophylactic anti-malarial drugs, because malaria for a person without a spleen is deadly dangerous. Before a trip, get all necessary vaccinations, take a sufficient supply of medications. Sports? Yes, but carefully. Contact sports where there's high risk of abdominal injuries, undesirable. Remember that the liver now partially performs spleen functions and can enlarge. Liver trauma can be even more dangerous than spleen trauma would have been. Work? If it's an office, no problem. If it's work with constant contact with people, especially sick ones, medicine education, you need to be more careful, especially during epidemics. Manufacturing work with risk of injuries, definitely inform your employer about your condition. There's another nuance that few people talk about: alcohol. The liver after spleen removal works with double load. It both destroys old blood cells and performs its usual functions: detoxification, protein production, fat digestion. Adding alcohol processing to this means overloading an organ that's already at its limits. So after splenectomy, alcohol is a serious risk for the liver, and right now I want you to subscribe to the channel and hit that like button if this material turned out to be useful. This really helps create more content like this that can save someone's health or even life. We're not just talking about medicine here. We're creating a community of people who want to understand their bodies and make informed decisions about their health. Getting back to our topic. The spleen isn't just a wrinkled egg or some unnecessary appendage. It's a full-fledged working organ with critically important functions. And when I hear from someone, "Well, the spleen isn't that important, you can live without it," I want to show them real stories of people living after splenectomy. I had another patient, Sarah, 28 years old. Her spleen was removed after a car crash. 3 years later, she got pregnant. And that's when the real challenges began. Pregnancy is a period when the immune system is naturally suppressed so the body doesn't reject the fetus. Now imagine immunity is already weakened due to the absence of the spleen, plus natural immunosuppression of pregnancy. Infection risk increases many times over. Sarah had to spend almost the entire pregnancy under close medical supervision. Flu vaccination, mandatory in the second trimester, avoiding contact with potentially sick people, at the slightest suspicion of infection, hospitalization. But she did everything right, gave birth to a healthy baby, although the entire pregnancy was constant stress and restrictions, and this is something else you need to know about. The absence of a spleen affects not only you now, but also all future stages of life. Pregnancy, aging, chronic diseases, all of this will be layered on top of already weakened immunity. There's also such a thing as functional asplenia. This is when the spleen is physically there but doesn't work. This happens with sickle cell anemia, celiac disease, some autoimmune diseases. People with this have exactly the same risks as after surgical removal of the organ, and they need the same prevention and caution. I think it's important to mention children who were born without a spleen. It's a rare congenital anomaly. These children from the first days of life need special care. They're vaccinated on a special schedule, they receive prophylactic antibiotics constantly until a certain age, and parents need to be extremely vigilant because a common childhood infection can become fatal. So, if we summarize everything we've talked about, the spleen isn't just you can live without it, it's an organ that protects you daily from thousands of potential threats. It cleanses blood, produces immune cells, stores blood reserve, participates in thousands of biochemical processes. If the spleen needs to be removed, medicine gives you a chance to survive and live on. But this life requires more attention to yourself, more responsibility, more careful adherence to medical recommendations. It's not scary, it's not the end of normal life, but it's a change that cannot be ignored. The most important thing I want you to take away from this conversation: any organ in your body is there for a reason. Evolution has been perfecting our biology for millions of years, and if something exists, it means it performs an important function. Even if we can live without this organ, it doesn't mean living will be just as easy and safe.